What prompted you and your colleagues to undertake this study?
Okay, so we looked at patient education material, in particular in overactive bladder. As you know, most of you probably already know, there's a very high burden of disease in OAB, and the treatment management can often be fairly confusing for patients. And we've seen this in past studies where there's a large portion of OAB patients that get treated with the initial first and second line therapy, and very few of them move on to more advanced layers of therapy. You know, I think a lot of that has to do with patients not really fully understanding how OAB is managed and all the different treatment options that are available. So I think there's very poor health literacy in this topic. So we wanted to look into what the patient education materials were available out there. And in particular, more and more patients are going to the internet, going to social media sources that aren't the traditional pathways where doctors, hand out a written handout. A lot of patients are going beyond that and going to, so I think as a field, we need to really understand what's out there and what's the quality of the material that's out there.
What were some of the notable findings, and were any of them surprising to you and your co-authors?
So so in our study, we looked at the top 25 search results when we searched for overactive bladder on YouTube, and it's a separate. We compared it to the 3 Urology Care Foundation. As most of you know, the Urology Care Foundation is the kind of the patient education wing of the AUA, and none of those, at the time, at least when we did our search, none of the Urology Care Foundation videos actually appeared in the top search results, which was surprising because this is kind of the official AUA patient education material that's posted out to YouTube. And there's quite an array of who's putting out the material. Some were from physical therapists, decent amount was from physicians, but not all of it was from urologists. For instance, one of the top viewed videos was by Dr. Oz, who's actually, at the time when we did the study, I was a fellow at Columbia University, and he's a cardiothoracic surgeon on staff at Columbia, but most people probably know him more from the Dr. Oz show. So it's a segment about OAB, kind of cut out from his show, and there's really a lot of inaccurate information in there, where he's recommending kind of more herbal remedies, and kind of the more quality sources were buried down in the search results. That was fairly surprising to us. Something else that from our results was that we used the patient education material assessment tool, which is a standardized tool developed by the Agency for Healthcare Research and Quality, which is an arm of CMS and the government, and this is a standardized tool for looking at the quality of patient education material. And there are 2 components. One is how easy is the materials to understand, and most of the material, even the material that we looked at, actually did okay. It was about in the 70-some% rating out of a maximum score per 100, and the understandability domain. So the material were decently understandable. Where they really fell short was in the second domain, which is again out of 100%, is the actionability domain. And of the top search results, they only scored about 57% out of a total of 100 in that domain. So while the materials provided the patient was decently easy to understand information, but a lot of them didn't tell the patient how to follow up and what to do with that information. And that could be something as simple as you should go make an appointment with your urologist, or if this doesn't work, this is the next step. So it's, that's one area that was surprising, where the patient education materials really fell short. In particular, if you compare the top search results to the Urology Care Foundation videos, the UCF videos really did much better, in terms of the actionability. They were very clear. They actually scored 100%, all 3 videos in that regard. So then that's significantly higher than the results that the patients would see first, and when they search for overactive bladder.
So you kind of touched on this just a little bit just now, and when you were talking about actionability, but what elements are necessary for a patient education video on overactive bladder to be of use for patients?
So the tool, I talked about it a little bit. The tool we use, the PMAT tool, or the patient education material assessment tool. So the specific tool we use, there's actually one specifically for audio video materials. There's another one, that's they're very similar, but there's some slight differences for print material. So we use the one because we're looking at YouTube videos for audio video or audio visual material. And the first domain is to make sure the material is easy to understand in terms of the understandability domain. So that could be something is, if you look at, kind of went through a question, and it's a series of yes or no questions, and it's something like, if there is print on the screen, is that easy to, in a font that's easy to understand? And is the language that's used, is that easy to understand? It's not using overly complicated medical terminology. It's using simple, everyday language to describe the condition. And the second component of the PMAT is whether the actionability, whether the patient can use that information to do something with, whether if it's suggesting a treatment recommendation, is it providing the patient how to obtain that treatment, or suggesting to the patient to make an appointment with their physician, and things like, is it using an active voice as an effective means to address a patient. Something that wasn't directly covered in our study is kind of the medical content or accuracy of the study, because the PMAT actually does not assess the accuracy medically. So you can actually, in theory, you can have a very well scoring patient education material that can provide completely false information.
What are some simple ways that practicing urologists can create patient education materials of their own and disseminate them to patients?
I think one thing we looked at in our study is looking at social media. So I think social media use amongst urologists is really particular among is becoming more increasing. And if you go to any urology meeting, recently you see Twitter handles, you see kind of Instagram hashtag and YouTube links. One thing I do want to bring up is that one thing we mentioned in our study is that if you look at the social media usage out there, only about 20%, a little over 20% of the U.S. adult population actually use something like Twitter on a regular basis, versus YouTube is actually, if you kind of roll that up into the social media category, has the highest use. Over about 72-73% of U.S. adults use YouTube on a regular basis. So at first I would suggest targeting using a platform that has a broad reach, particularly with our population of patients, which do tend to be a older population. So I think you do get much bigger bang for your buck with some of the platform like YouTube, for instance, versus Twitter, which may be more appropriate for urologists to engage amongst ourselves. But to reach out, putting out patient education material out on something like a platform that has a broader reach like YouTube would be something I recommend. So.
Do you and your co-authors plan to conduct further research on this topic? And if so, what will the focus be?
I think, in this study, we focus specifically, one on overactive bladder, as well as on a single platform on YouTube, and looking at the quality of the patient education on there. Certainly we can expand to look at other urologic conditions. And I think there are actually some other authors out there. Stacy Loeb has done some great work in this field, looking at prostate cancer, literature that's out there, or patient education material that's out there, for instance. So we could look at other disease areas within urology, as well as evaluating other sources that patient can obtain patient education material. This could be Twitter, Instagram, or other social media platforms, to Google searches, as well as, as we know, probably a lot of patients, as soon as they go home from the doctor's visit, they go home and start Googling stuff on their own. And sometimes that can lead to a lot of misinformation, particularly when they land on these low quality sources. So I think as a physician, it's kind of been, on us partly to kind of identify the material that is high quality and direct our patients to those sources, not just through the handouts we give to them in clinic, but also through multimedia sources. And I think in this day and age of COVID, where there's a greater transition to telemedicine, I think this could be an integral part of telemedicine and kind of educating our patients virtually.
Is there anything else you feel that our readers should know about the study findings?
So I think, the goal of patient education material is really to help our patients to better understand their disease, as well as the treatment options that are available and what's being offered to them. It's to help them better understand things. But when there is, these materials has poor understandability and doesn't really give them a way to use that information, that's really doing the exact opposite. I think it can generate a lot of confusion. It's really on us as physicians and as urologists to identify the quality material that achieves that goal, that helps our care. And oftentimes in clinic, when we have limited amount of time, we may not have the time to explain everything to our patients as much as we try. And the patients themselves may not have all the questions. It's kind of can be an awkward situation where they may not even think of questions to ask. So I think patient education material can really kind of be a bridge as to that interaction, that physician-patient interaction, and as well as for future interaction. So you prompt the patients to have questions. This is a question I should be asking to the provider. And some of the material we reviewed out there actually formatted in that format. These are the type of questions that you can ask your physician to specifically about this particular treatment or about your disease. So I think it makes it a more high yield interaction for subsequent visits if patients can review those materials. So.